One of the main reasons why you get kneecap pain is because your kneecap or your patella is not quite sitting in the middle of the hole called the trochlea. Now, if your kneecap is slipping and sliding, it can cause pain. Clicking, a feeling of instability, can also be sore when you're squatting. Now, a few things determine where the kneecap sits. First, it's the strength of your big quadricep muscle. So your quadriceps, particularly the vastus medialis, helps to keep the kneecap in the middle or towards midline. Now, if it's not strong enough, if you don't have strong enough thighs and quads, that patella tends to creep out to the side and it will be pulled along by a tight gluteal and a tight ITB to the wrong side of your knee, and then it gets grating. Your kneecap grates against the side of the femur and you start to get pain, and if you leave it long enough, it becomes arthritis, and you might even be diagnosed with chondromalacia patellae, which is just a fancy term for the cartilage wearing away on the back of the kneecap. Now, apart from getting your thigh stronger, you also have to get your glutes stronger. Now, if your glutes aren't strong, your femur will tend to roll in and out. So the socket which a kneecap sits in is not on a stable ground. So this video is all about strengthening your hips and your thighs. I'm going to give you 3 simple exercises that you want to master to get rid of patellofemoral pain once and for all. Now, starting from the single leg sit to stands, we're going to start from 45 centimeters. Now, you can go all the way up to 60 centimeters, which is most bed height. Now, if you're standing on one leg, you want to sit down gently onto the bed, and then using those thigh muscles, we're trying to get them stronger, and using those buttock muscles going all the way up. The foot can turn a little bit, but what we don't want is excessive shaking of the knee. If you cannot control the shaking of your knee, it means you're not very stable. The kneecap might be slopping here and there. A little bit of shaking is fine, but we want you to be able to control it. Once you master 60 centimeters, we want to go slowly lower over time. Now, I've got this 45 centimeter stool. You can practice this 10 or 20 times until you get quite good at it, to eliminate the shaking. If it's sore, painful, don't go lower too quickly. Now, going on from the single leg sit to stand to the Bulgarian. Now, the Bulgarian is not so much balance oriented. It's possibly more purely strength. It does require more ankle flexibility. We want to go all the way down to at least parallel with the ground. Try to eliminate that shaking of the knees left and right. If you can't control it, hold 2, 3 and come back up. Same thing. If it's painful, don't go down too low. Just go to what you can manage, and you can hold on to things. You can hold on to a chair. We've done a full-length video on how to get really good at the Bulgarians. You do want to be able to do this 10, 20 times all the way down. Feel the thigh muscle, the inside of your thigh or the whole quadricep muscle, and your buttocks should also be working well in unison when you're doing all these exercises. That's what we're after. Thigh, buttock working well to control a very stable and strong kneecap. If you are strong enough at this, you can add some weights and you can do more of them, or you could hold for longer. Finally, the single leg lateral step down. I am starting from a small step. This is only 15 centimeters. I'm tapping very lightly on the floor with my opposite heel and going back up. So the leg on the step is doing all the work. It does require a bit of balance on my ankle. We do not want your knee again to be shifting in and out too rapidly. Generally, the less the better, although a little bit of shake is fine. Once you've mastered 15 centimeters on both sides, start to go higher. For the average person, this is slightly challenging. Thighs, buttock muscles. We want to get these muscles bigger and stronger until you can master this, doing 10 or 20 soft taps before you move on to the next step. Generally, quite athletic people can do this pretty well, but still struggle a little bit. If you're higher than this, you're probably in elite territory for leg strength. I have to hold on to something. If you can see my hands here, on my left hand side, I've got to hold on with both hands and then do 10 or 20, and well done. You're getting stronger in your knees, you're getting a more strong kneecap, you're preventing arthritis on the outside of that kneecap from developing, and you might actually get less clicking as well. Now, clicking can be natural for some people. If it's not painful, it may just be entirely normal for your knee. So don't worry about that too much. Try to focus more on building your strength and your flexibility. Getting good at these 3 exercises will ensure you have strong hips, strong knees, and a good kneecap for life. Patellofemoral pain can be very easy to treat. It usually takes a few months of solid strength training, and you should be able to return to all the duties you used to do. If you're still having trouble even after doing these exercises, perhaps go for a scan, have a look at the quality of the cartilage of your kneecap. But for the majority of you, this is going to be the solution. Thanks for watching. Hope you enjoyed the video. Like and subscribe. Build up that muscle strength in your thigh and your glutes.